Welcome to Your Health Matters. I'm your host, Temesia Tuicaumia, and tonight I have a special guest, Dr. Rachel from Ministry of Health, who is the head of Family Health. Dr. Rachel, how are you tonight?
I'm good, thanks, Temesia. It's
I
good to
haven't
be on
seen
the
you in a
show.
while.
Yeah, that's true.
You've been very busy.
Oh, well, work keeps us
Yeah,
busy,
work
but
keeps
it's
you
been
busy,
good.
but your
Yes.
team's been doing such an amazing job with advocacy.
Okay.
Well, it's really good to have you, and tonight I thought it'd be really great to have you come in to really share about how our country is doing right now with HIV. There's a huge rise in that area, and also with drugs, and how HIV is also playing a strong role with that as well. And so it'd be really cool just to hear from you, Dr. Rachel. How's our country doing?
Thanks, Temesia. Very, very valid question at this
Yeah.
point in time. And very recently in January, we declared an outbreak for HIV.
Okay.
I believe towards the end of it, when we launched the Fiji National Search Plan for
Right.
HIV for the country. And this was in response to the increase in the numbers that we had been seeing. As we speak of, we haven't released the national statistics till December, but as of Jan to last December,
yes.
of course, but as of Jan to September alone in 2024, we had about 1,093 individuals who are newly diagnosed with HIV, and this was cumulatively, we know. In Fiji, we've had about more than 3,000, about 3,170 individuals from 1989 when Fiji first got to see HIV in the country. And there's been a lot of escalation in this space. And within this 1,093 individuals, we had about 23 children who were between the age of 0 to 14 years of age.
Wow.
And we also, within this space, we know there is a mode of transmission we call mother-to-child transmission.
Mother to child.
Yes, and of the 23, there was about 18 that were transmitted from moms to their children, which can happen at any phase of the pregnancy or even post-pregnancy as well. But as a nation, we had been seeing that increase, and very reason why we had been scaling up a few things as well, especially testing. And there's a lot of work that needs to be done. Predominantly, this numbers that we're talking about is predominantly centrally located, as in within the central division.
Oh wow, that's interesting.
yes,
So it's not really happening in the outskirts.
It is happening in the
happening,
outskirts,
but not as.
but almost 70% of our patients are
coming
within the
out of-
central division.
Wow. And that's all from just the case studies that you've been collecting.
We've been. These are basically these are individuals who go through testing.
Wow.
It's either we provide them with testing, or they would end up in the hospital being unwell.
Yeah.
So they could come out positive in that phase,
Wow.
or through mother-to-child pregnancy, women get tested positive. So there's different areas, but also through our clinics. And one of the things that in the very recent few years that we've introduced is something called point-of-care testing. So basically, point-of-care testing.
That's cool.
So point-of-care testing basically makes available, for example, you and I are sitting here,
Yeah.
and I can literally test your HIV screening right here and then.
Really?
Yes, and it takes about 20 minutes to get that test done.
Wow, not bad.
And but the only thing is being mindful that these diseases, I mean, we don't just with HIV infection, we don't say, okay, one test positive is your 100% confirmed positive. There is a process within the laboratory space. So within the laboratory space, we have a confirmation of 3 kits, like we do test 1 screening.
Yeah.
And if the screening
It
is
reminds me
positive,
of the COVID ones where
Yes.
you take more than.
so once you're tested positive through screening, then obviously you have to go through the confirmation testing. Same thing for children as well, babies as well. So so point of care testing is
I really
something
like
that
that.
we escalated with.
Right.
And I must say, it's not in every single site in the Ministry of Health, but we
it's
are
slowly-
slowly scaling up, and we are scaling up significantly ever since we've declared the outbreak, and we're working with the divisionals.
What was it like, declaring that outbreak? There must have been like a shock within the whole country. Everyone just like paused.
It would be, it definitely would be, because increasing numbers warrants increasing response as well.
Wow, yeah.
So
What's it like, Dr. Rachel? That fear factor, because a lot of people too might be scared to come and test. And so I've just been enjoying seeing Ministry of Health have all these these advocacy projects going on, and you can just see people turning up in numbers. I think at the Drua game as well,
Yeah.
they were there. So I think that breaks a lot of the fear too for people.
Yeah.
But
No,
from your
absolutely.
expertise as a doctor, what has it been like trying to break the shame and fear?
One of the big things with the HIV testing is obviously one of the major things that
Yeah.
becomes sort of discriminatory, stigmatizing for individuals is
Yeah.
that it's sexually transmitted, and the other
Oh,
common one is
right.
the other common one being that now if individuals share needles, you can get HIV as well.
Right.
And obviously, there's other means of transmission like mother to child and all,
Yeah.
tattooing, etc. If needles aren't
Right.
changed. But having said that, like we've always encouraged individuals to know your status. It's very important that individuals who've indulged in multiple sexual partners,
Right.
with multiple sexual partners, or even indulge in, drugs and indulge in sexual activity, continuous sexual activity, and even sometimes it's even group sex, etc. And obviously, unprotected sexual intercourse,
Unprotected, yeah.
and all this. Like if individuals are out there, one will never know that they have HIV unless they get tested.
Right.
So one of the things we always encourage is get tested. I know it's sometimes we know it's a fearful thing for individuals to go
Yeah.
through this process itself.
It's a
Just the
cultural thing
fear,
too, and that
exactly,
fear.
exactly. And it's talking about sexual activity or these things. It's predominantly been taboo. But I think we need to walk away from
do.
it and say, let's make a difference.
Yeah.
Let's make it right. Let's
Wow.
know our status.
Yeah.
And respond appropriately, not for the other person, but firstly for
For
ourselves.
you, eh?
For
It's
ourselves.
important.
And,
Wow.
if you know you're HIV negative, maintaining that status is something you need to be proud of. And unfortunately, if individuals do become HIV positive, we've always said that it's not a death sentence.
It's not a death sentence.
There's treatments available.
Yes.
And we've seen so many patients make it through so well and live normal. I mean, I can say proudly, like one of the things one of my own patients from 1989 is still alive and living today.
Oh, really?
And obviously has children, has
Yes.
grandchildren, and that
well.
life goes on. But the thing is, taking ownership of your health is so essential
It's
in
so
that
essential,
space.
huh? Well, thank you so much, Dr. Rachel. Everyone, please get tested. We'll see you right after the break on Your Health Matters. Welcome back to Your Health Matters. I'm your host, Temesia Tuicaumia, and tonight I have a very good friend, Dr. Rachel, who is sharing with us about our cases with HIV in the country and what our country is doing about it and how you at home can also look out for yourself and for your community. Dr. Rachel, I'm still caught up with this story from 1989 about the gentleman who's still living with it. And has a family. I think that's so beautiful because I feel like everyone just hears HIV, I'm gonna die, and but that is so cool to hear a story of someone that's still living
No,
with
that's
it.
true. And there since afterwards, there's a number of individuals
They
who've,
are,
who've successfully gone into treatment. And one of the
Sorry,
things...
Dr. Rachel, when they go into treatment, they have to take medication
Yes.
every day, or
It's every day, and I must say, back in
wow.
about 3 decades ago,
Okay.
there was medications that were more than 9-10 pills a day.
No way.
But
So now it's less.
in this day and age, we only have
Wow.
1 pill a day.
Oh, wow.
So it literally
That's
reduces
a big change.
definitely is. There's a lot of progress in the space of HIV. The only thing is, the most important thing is our mindsets, which we need to change.
Wow.
And we've lost a number of individuals to HIV in Fiji because of stigma, discrimination, probably
Yeah,
by
that's such a
others,
strong one.
but also could be individual. Like
Individuals,
sometimes we don't realize that we're
Yeah.
stigmatizing our own selves. We're discriminating our own selves by not, by thinking that the other person is
Yeah.
thinking that way. So, just getting out of that mindset and
key.
finding your support network is so essential.
Having a good
Having that
community, yeah?
friend, having that family that will
Yeah.
support them through this process. And we don't need to lose our young people or
Nope.
anyone to HIV
Yeah.
in Fiji today. And this is one thing we really need to encourage our people, just be that support person.
To be that support
And,
person.
sharing a table, sharing a plate, sharing food together,
That is
hugging,
such-
etc. These
yes.
things don't transmit
Nope.
HIV. No, they
And I
don't.
feel like that's the strongest one we're facing
Exactly.
right now.
Yeah.
It's just when you hear someone in the community say, oh, that one has, it's like,
Yeah.
oh no, do we invite them? It's like,
Yeah,
what,
I
are, you,
mean-
what are you talking about?
Yeah,
Yes.
absolutely. Because
Oh, wow.
we've had scenarios where people living with HIV, you sit
Yeah.
beside them. Some people obviously get the shock of their lives. Oh, that person HIV
Yeah.
positive. But in honesty, they're just like you and I.
Yeah.
They're absolutely healthy, especially when they're on medications. They're really well. And mind you, having said that, I wanted to mention this as well.
Yes.
That when you're on medications,
Yeah.
there comes a point in time when you're virally suppressed. What I mean by that is
I've
the
never heard that
virus,
term before, yeah.
the virus literally goes down, almost undetectable. So
Really?
when it becomes undetectable, individuals, for example, husband and wife,
Yes.
if one is positive, the other is negative, they can have children. And the child can be negative and the partner will remain negative.
Wow.
That is possible with medications on board. So we've
This is
had...
why go get tested.
yes,
So you
exactly.
know.
Go get tested, know your status.
Wow. Sorry, what did you say again?
Virally suppressed.
Virally suppressed.
And
Wow.
it's a concept we use for U equals to U, basically, where an individual is HIV positive, they're on medications,
Yeah.
they're virally suppressed, and through that process, they can have a partner, a family, and not transmit the infection to the other, even to the child.
Wow.
And with that, they literally live happily. And we've got so many discordant. Where a partner is positive and the other is negative, we
Yeah.
call them like discordant couples.
Oh.
And we've got so many around us that are like that. And
So many new things I'm learning about this. That's so cool.
so there's so many, and it's worked with medications around it.
Wow.
And one of the things to also mention is this medications in Fiji are for free. The government's been providing it to
Did you just
individuals.
say for free?
Yes, it is for
Wow.
free. And just like every other medication through the
Yeah.
ministry, and we've been making sure we've been working towards...
That's a really strong one, Dr.
Yeah.
Rachel, the mental health. Because
absolutely.
it seems like these services are here, but
Yeah.
people are just...
just
the stigma,
stepping back
it's-
behind it, exactly.
Yeah.
And and I mean, any young person out there, if
Yes.
like I mentioned earlier, if you've been into any risky behaviors, like I mentioned earlier, it's always wise. Don't be naive to the fact that I may not get it or I will not get it.
Right.
Let's not be naive about it. That's the naivety can literally kill us.
Yes.
But be strong enough to say, okay, let me get tested. Let me know my status. Because that's important, and without doing that, one will never know. I mean, just like you can never say with cancer, HIV, TB, etc. It's only through diagnosis that you
Then
can.
you will know.
And from that, you get to know your appropriate, go through towards appropriate treatment as well. When you look at our mother-to-child transmission of
Oh,
HIV,
yes, that's a really good one to cover.
that's even to the point that when moms get pregnant and they never knew their HIV status before, but the earlier they come into booking, because one of the services we do provide in the ministry is every booking, every mom that goes through pregnancy would get a
Yes.
HIV test alongside syphilis and hepatitis B testing.
Okay.
And when the women, the mother, the partners, the family know of their HIV status, it doesn't stop there. If it turns out positive, we provide medications for the mom.
For mom.
Yeah, exactly. And then when the mother is on treatment,
Yes.
literally, we're hoping they come earlier than later, because the earlier the better. In that context, it reduces the transmission of the virus from the mother to the child.
baby.
Exactly.
Wow.
So the child can literally be born negative.
Negative.
We follow individuals through.
Yes.
But in this context, Temesia, one of the things that really becomes essential here
Yeah.
is women need to come in early for booking. We encourage early booking right
Moms
across
to
the
come
nation
in,
for
yeah.
moms, right across the nation, because the earlier individuals come, the earlier they get tested, the earlier they
And you
know,
can start
the
doing this
earlier they get
prevention.
into treatment,
Yeah.
and you start literally preventing. That is primary prevention for the child right there and then. And this is one thing we literally strongly encourage our women to do. And
Yes.
let's not be naive that okay, I've got 3-4 children, I should be fine with the
Right.
other pregnancy.
Mm-hmm.
But every pregnancy is
Yeah.
different. That's one thing we've always got to be
I think
mindful
it's
of.
important to what you just said, like that naive, that,
Yeah.
it can kill you. Like if you're just going to keep
Yeah,
brushing
exactly.
it on the side, you will never know.
Absolutely.
Wow.
And one of the other interesting thing about the statistics right
Yes.
now is we know that about close to 80-90% of it affects our Ethiopia population. But the other
Okay.
context to look at is we were looking into this data. What's the higher population testing right now? It could be the Ethiopia population.
Oh, okay.
So
I
it
get
could
what
be
you
a
mean.
naivety
Yeah.
even itself within
Yes.
the Indo-Fijian community.
Indo-Fijian and other
Yes,
races.
exactly.
That
Within the
needs
Fijians of Indian descent, they could be testing less,
less.
a lot less
So
than
these are things you have
exactly.
to look at.
So, but
And then for the major public, we're just like, what? More Itoke?
yeah,
And it's just
exactly.
right away. But that
But
could be
the
case.
reality could be there could be less testing.
Yes.
These individuals aren't coming to us. So if they are, they're going to private sector, which is fine, which is great.
Yes.
But knowing your status is
It's
what's
important.
important.
Wow. Well,
And
Dr.
testing.
Rachel, thank you so much. The stories have been just going. I hope you've been enjoying our segment tonight on HIV and what the Ministry of Health here in Fiji is doing and the advocacy and just learning from Dr. Rachel tonight and her amazing team that are out there. We'll see you right after the break on Your Health Matters. Welcome back to Your Health Matters. I'm your host, Temesia Tuicaumia, and tonight I have Dr. Rachel, Head of Family Health. And tonight we've just been talking about our cases of HIV in Fiji, and I think the most important thing that a lot of our friends and family out there need to know that these testings are for free. And even the medication that Dr. Rachel was sharing is for free. And I think just hearing testimonials of patients, that have been coming in and just their stories of how they're doing okay and they're doing better and some have children and grandchildren now, hasn't passed on to their children. I think that's really cool. But now I think we really need to break down this the socioeconomic challenges, I guess, that people have around it that still causes that stigma.
Yeah.
If you could elaborate how it's been like for the Ministry of Health, covering the whole of Fiji, that's a lot. And I bet each town and city have their, and community and villages have their challenges.
Yeah, no, thanks, Temesia. I think one of the things from a program perspective for HIV, we've got 3 sexual reproductive health centers, hub centers we call them.
I did not know
in the Western Division, in Central, that looks after Central Eastern, and in the Northern Division.
Oh, nice.
These 3 hub centers have been predominantly, and that's where honestly, I started my career some time ago, 17 years ago.
That? Yeah.
And these 3 hub centers predominantly.
You can say, Dr. Rachel, almost 2 decades ago.
These sites would be the overarching sites for a division, and that's how we're structured in the Ministry of Health.
Okay.
And looking at the number of cases, we know we have to a certain level decentralized as we've progressed, but it hasn't been as significant as we'd want it to be now because the caseloads have significantly increased.
Oh, okay.
And one of the main reasons, like for example, when you look at the socioeconomic factor side of things, because it's access as well.
Yeah.
Access is
Access to these
important,
services,
exactly.
right?
Access to the services is essential. And we've recently been really ramping up and making sure our healthcare workers are trained. So obviously we've had to update
I can imagine
our...
the amount of professional development for
Exactly.
your staff. It
Because
covers the geographical status of our country.
exactly, because one of the bottom line things is you don't know, you don't do. So
Hey, that's a good one. Can you say that one more time?
I mean, you don't know, you don't do.
don't do,
So one of
yeah.
the things we're really ramping up and making sure is our healthcare workers are able to recognize it early, not late,
Early.
and respond to individuals early and prevent them from dying on us,
Yes.
unfortunately. And so one of the important things that the Ministry of Health is really working on, and we've been going at doing some micro plannings and implementation on the ground of very recently, is decentralization of our services that were predominantly in the SRH clinics, in the hubs. Exactly.
Those 3 hubs.
So that will definitely increase access for individuals.
Right.
Across the nation. And when I mean access, it's not just testing, but also for treatment.
Treatments as well.
But Temesia, one thing I wanted to make clear is that any individual in Fiji can go to any health facility and get a test done.
Any.
It may not be a point of care testing as we speak, but they will withdraw blood and send it for a test, and that result comes back to individuals.
And sorry, these are the medical.
That is a health facilities. Yeah, exactly. All the health facilities in our communities,
Okay,
right
so they
from
can just go in.
Yeah, they can walk in. They can get a test done, a confidential test done, and that result would come back at least within a week or 2 weeks max. Should
and
be,
go back
and they can go back and get their results. Check their status, or individuals can even go through our government NGO partners as well. We've got.
Oh wow! So not just Ministry of Health. You've been partnering with all these
yes, absolutely.
NGOs. Wow.
We've got our team that works with the prison department. We've got our team that works with. There's medical services specific. There's REF in Fiji. They're decentralized across the nation. They provide these services, and these NGOs actually do point of care testing in the field as well.
Oh, they do.
And they've actually been the one helping and supporting us going to
that's fantastic.
the Draw Games, and I believe we should be setting up the Code Games. Exactly.
That we've been seeing
and we've also got organizations like Rainbow Pride Foundation that's been doing this supporting mechanisms.
That is cool.
So we've been training a lot of partners to do point of care testing out on the ground.
It reminds me of that African proverb. It says, if you want to go fast, go alone. If you want to go far, go together.
Exactly.
So that's really cool what the ministry is doing. It's
so exactly. So that collaboration for us has been very essential.
Wow.
And mind you, every university, we're working with universities as well.
So I can imagine that's so crucial.
Yeah, exactly, because of that age population as well. So we're working with USP, with FNU, with other universities around, just making sure that these services are available for them, not just condom provisions, but also things like services like point of care testing, knowing your status, maintaining it.
And I love what you said. It's just a space where you can come and just talk. And
exactly.
If you want to know more about these things.
Absolutely. But the important thing over here is the fact that you need to go back to get your results. Make sure you get it.
Okay.
Don't fear out.
Step 2. Step 1.
Step 1 is get there. Step 2 is go back to it. Yeah. I mean, there will come a point in time.
That thing you were talking about, having that one friend, that family
member,
that community.
Absolutely. And this is where we really. Within the space, as a ministry, we are working on making sure confirmation is available on site as well at that first visit.
Whoa.
But there are processes we need to sort out before we get to that, and we're trying to escalate. Exactly, we're trying to escalate that as well as we're speaking. So, but just that first step of going out and knowing that every health facility out there is accessible for a test, that's important.
Yeah.
You
They're
can turn
ready
up.
to receive you, everyone.
Yeah, they definitely have this available to them.
Yes.
And then making sure you go back for that result is essential. At least within the 2 weeks period.
Yeah.
It's essential for you, and because sometimes we lose our patients through that process, unfortunately, where individuals don't turn up. And in Fiji,
sometimes we think it's just the testing, but it's actually the going back. Yeah?
Exactly. We've got about.
I can imagine how daunting it could feel for someone who, like, I'm not going back.
No, absolutely. I mean, if I were to say, okay, get your test done, see how you feel after getting that one test done. And we do have currently almost 50% of our patients who are HIV positive lost to follow-up out there in the field. And we really encourage individuals to, go get your status known yourself. And if you're positive, get onto treatment. If it's negative, maintain that status. It's something to be definitely proud of, to maintain a negative status. And obviously, the other thing is to be on treatment. And, and basically, having said that, with the decentralization context here, the access context comes in as well. So we're making sure we're working towards a space in very near future, as in the next few weeks, we should be able to decentralize it to the teams on the sites, and not just be based out of the main cities or towns.
The three
because
hubs you're
exactly
talking
the
about,
three
huh?
hubs. And it's something that we've been working with the divisions on in terms of decentralization and
I
making
can
sure.
imagine how much that's just going to break so much barriers.
Yeah, no,
Like
absolutely.
all these little villages and settlements
Yeah.
out there to see Ministry of Health come through and be like, hey guys, you know, to educate them and bring
Yeah.
awareness.
And
It's really gonna
and
open
it's
up
it's
their
happening right
eyes.
now, but definitely we need to ramp it up a lot more, which is
Yeah.
happening with the team on the ground.
Well,
But
Dr. Rachel, before we end, you know, my favorite part is where I get to say, Dr. Rachel, what do you want to say to all the Fijians out there? You know, just to really push. And I think I really love what you just mentioned. You know, it's having a community and being strong and going out there and, you know, that love support is so key and
Yeah.
decentralizing. But if there's anything else that you just wanted to really direct it out to the young children out there, teenagers, or those that are, you know, have gone into that drugs abuse, and that this could be
Yeah.
a reason why they're getting HIV. But it'd be really cool for you just to speak to
yeah, no,
everyone
no,
tonight.
Temesia, absolutely. Thank
Yeah.
you. You know, one of the very important messages I've always been talking about is know your status first. I mean, as individuals, if you know you've been indulging into unsafe sexual practices, you've been sharing needles, or even the practices of Bluetoothing we've talked about in other media platforms, or you know, and if you've ever done any of these things and that's been unsafe, just go get tested, know your status, and if it's negative, maintain negative. If it's positive, please get onto treatment, because there is treatment, there is hope. No one has to die of HIV, and for pregnant women, get into booking early. And I think one of the most important messages also I want to talk about is to the families out there: talk to your children. Be open
Yes,
about it.
yes.
It needs to start somewhere.
Have this conversation.
Exactly. It needs to start somewhere. And I think we're living in a, the society has changed so much where our children are a lot more open than probably some of us.
Right.
But they also want to hear it from us as parents. So I think it's important to start talking somewhere, even if it be simple things like menses.
True.
What does
True.
what does menstruation mean to your
Yeah.
girl? And what does it mean to your boy, the growth, developments, etc. Start
Yes.
somewhere, because we need to break the ice. We need to break it, and as parents, as family, as guardians, it needs to start with us. It's a whole of society response, I believe.
We all have to be
we need to
active
take ownership.
bystanders,
Exactly.
yeah.
We need to take
Break the
ownership
cycle.
of this. Exactly. Break the cycle, break the silence.
Yes. Oh, can you just say that one more time? That you see, sorry, that little slogan you said. You see, you do.
Oh, basically, you see, you do, you don't know, you know, you do, you don't know, you don't do.
That's a good one, because I think that's that's really it. We don't know. We're like, okay, I don't want to go. Yeah.
But it's good to be knowledgeable.
It is. Well, thank you, Dr. Rachel. Well, that's it tonight on Your Health Matters. We'll see you here next week, same time on My TV.